Hi, I'm Dr. Sharon Webb. My specialty is vascular neurosurgery, and I'm a physician at St. Francis. My younger brother had a cleft palate, and we actually grew up very poor, and so he had to have it fixed for free. It was called the Sunshine Foundation, and after seeing what great things physicians do and how they help people, I decided to go into medicine. Well, I chose neurosurgery because when I was a teenager, I got to see a brain surgery while I was working in the hospital, and I fell in love with the brain, and I never looked back. So it was my subspecialty from the very beginning, even at the beginning of medical school. But I didn't choose vascular then. I actually chose trauma, but when I came back to Columbia, South Carolina, where I was born and raised, no one was doing vascular, and so it just kind of happened that I ended up doing it and fell in love with it as well. So what do I love about my profession? Well, first I'd just like to say that I consider myself a physician first and a surgeon second, because I love my patients, and I actually get to know them and their families, which is unusual for a surgeon, but I think that the physician-patient relationship is the most important thing. It's not the cool procedures, it's certainly never about the money, but for me it's really about helping people, and it's all about my patients. So on the first visit to me, the patient can expect that I will go over in detail why they're there to see me, what their diagnosis is, what that means. I go through any films that they may have, and make sure that I answer any questions. I'd like for them to leave knowing exactly what they have, and feel comfortable that all of their questions have been answered, and that they've been educated on whatever their issue is. So what do I think makes a good doctor? Well, I have pretty high standards actually, so I probably, my definition may not be what others are, but I think it's someone that's willing to sacrifice for what's best for the patient. If that means time at home, that means time away from your family, not being there when it's holidays, whatever it is that the patients need for you to do as a physician to do the best that you can for them is what you need to do. And a lot of times that is a lot of personal sacrifice, but that's what makes a really good physician. One that will sacrifice and has compassion, a lot of compassion. I think it's fantastic that St. Francis is Catholic-based, and in fact, when I visited the campus the first time and saw the statue of Jesus, I was very moved that they have there, because I'm a Christian, and it's a big part of me and what I do, and my patients as well. I hold their hand, I give them hugs, they know me by name. We pray together if they need it, and so it's very special to me. The best feedback I get from my patients is that they're doing well, that I give them comfort, that when they see me they know it's going to be okay, that they got to go back to their families, or they come in and tell me stories of how they've been doing well, or I had one patient who came in and played a song for me because he was able to go back to church and play in the choir again. That's the best feeling, when you know you've helped them. So on the rare occasion that I get to leave the hospital, I do play the piano. I also paint. I do abstract painting. I run. So I've been trying to train for a half marathon, actually, next month. So, and I dance.